As much as we know, coronavirus is a virus itself, and we know a virus infection are treated symptomatically, and we know that as much as the government is ready to do the training for the professionals, we already have the information about the virus itself. But let me say this: as much as we're ready, we need the PPE, the personal protective equipment, because we're targeting. Because they said earlier, the CS for health said earlier that this is the peak. Actually, the spread is going to be high, especially in this April. And for us to contain this, I think we need to put more measures on the preventive side, so that the medical practitioners, especially let me say about the clinical officers, who in most cases in Kenya, almost like 80% of the facilities, patients are being attended by clinical officers. We need to protect the medical practitioners. We need the PPE, the clinical officers and the medical staff at large, such that, because if, assuming one medical practitioner is infected with this virus, high chances are is likely to transmit it more than another person, because per day you see a huge number of patients. You examine them, you are very close with the patient, and this exposes the life of patients if the medical practitioner is positive for coronavirus. Oh, thank you for that question. I don't know the situation right now, but what I know, Kilifi County, in terms of ICU, to be more specific, Kilifi County, I think we have a challenge on that. Because within Malindi, I don't know any facility with the ICU department. I don't know anywhere in Kilifi. Maybe they have started, but I've not seen it before. The only place I know is Mombasa County, where we have the Coast General and the other, like Mombasa Hospital, the Aga Khan, and other private facilities. But within Kilifi County, I'm yet to know. Sorry, but we don't have ICU. Yes, Kilifi, the people or the community itself, they tend to believe something when they see it happens. For example, if your neighbor has not been infected, or your brother or your sister, it's hard to convince someone that this thing is real, because most of them say, being blacks, this thing can't affect us. The black melanin is as I said earlier, the people within Kilifi County, through the media, through the radios, this thing has to be repeated on and on, because not many believe that coronavirus is real and it can kill. Actually, they can believe this when they see their partners or their family being infected. But I want to say this: we can't wait to reach this stage whereby you need to see everyone being infected and then you put more action. The people have a role, the government has a role, but as the Kilifi County itself, the people within Kilifi County, we need to put more measures. When you talk of self-isolation, and I see a boda rider carrying 3-4 passengers, and then that means that something's not understood. That means that still we're not ready to face this. Yeah, that's what I can say. Government need to do more sensitization. Let the people know that this thing is real. Yeah, let's the people of Malindi be informed. I don't know how it's going to be done, but we still need more sensitization in Malindi, specifically where I stay, about this coronavirus. Yeah.
And one way of combating this thing is we have to increase our human resource workforce. So we have recalled all nurses, all doctors, all clinical officers who are undergoing postgraduate training to come back to Kilifi during this time of a pandemic of COVID-19. So far, like now, we've got 92 staff who have reported back by yesterday. We have identified schools, 2 schools in every sub-county, to act as quarantine facilities. Quarantine facility is a place where if somebody is suspected that you have somebody who tested positive and then you do contact tracing, and this person says, I've been with A, B, C, and D. So those people, we need to trace them, get them, and put them somewhere. Yeah, while we take specimens to prove if they are negative, they go home. If they are positive, then they have to be isolated. And here, this is a bit tricky because quarantine, you cannot mix people who are negative and those who are positive. Okay? So we have to be very careful here when we say quarantine, because you might get a suspected case mixed with somebody also suspected, but one turns out negative, the other one turns out positive. So we have to be careful. So that's why we've chosen the schools where a person who fits a case definition is a highly suspicious. This one might be positive. Then we can put them, we can have one dormitory for that. And another dormitory where is somebody maybe in contact tracing, but most likely does not fit in the case definition and maybe at less risk. So we separate them from those ones who we feel that they are at high risk.
We are quarantined, but anyway, in isolation, so I use for an apartment. From there, this is the fault.
Yeah. What they call it?
That's not a fault.
What is the nose?
The nose is here. Why imezifungwa kapa na ndozi kunozi kwa hapa nyuma. So, this.
Wacha vai kwanza. Wacha vai kwanza. Then after one.
Nimepata mkono.
You see, you look like you have COVID.
Fit, ama? Unaangalia kama
We're just waiting for the goggles.
Huyu mgonjwa atataka kupewa mask.
Mgonjwa para mask.
You're supposed to mask.
zamani. Hii ndio nilikuwa naanza kuicharge ile time.
Amweka kwa baki.